Hello, everyone. My name is Daryl Gordon. I'm Vice President of Marketing at MediKeeper, and thank you for joining us today. So today's session is going to be a little bit different. If you've joined us before, I can tell you we've got something really special planned for you today. But before we dive in, two reminders. Number one is if you have any questions, you can submit them using the chat functionality that's right at the bottom of your screen in Zoom. And also, we are scheduled to promptly end at 25 minutes to make sure you can get back to your next meeting. So today's webinar is more of a fireside chat, as we have three industry experts on the call today, all to discuss the topic, nutrition's relevance for brain health and resilience. And to introduce our guest speaker is MediKeeper's Chief Health and Strategy Officer, Dr. Tyler Amell. So Dr. Tyler, the couch is yours.
Thank you very much, Daryl, and good morning, everyone. You know, I've always fantasized about having at least a recliner in my office so I can take steps away from my sit-to-stand desk, and you know, a couch would be even better for those mid-afternoon naps for sure. Maybe that's something to consider for the future. So once again, thank you so much for taking time out of your busy schedules to join us here today. So as Daryl mentioned, this is going to be a little bit different situation. We're going to be essentially having a fireside chat. So Dr. Jaime Pulaand is joining me again for, I think this is our third webinar together, right, Jaime?
It is. Good day, everybody.
And we also have a very special guest star. So that's Dr. Bonnie Kaplan, who is a semi-retired professor from the University of Calgary's Faculty of Medicine. You want to say good morning, Bonnie?
Oh, good morning. I didn't know if you were ready for me. Yes, thank
you.
I'm delighted to join you folks. You are delightful to watch in your last session.
Wonderful. We really appreciate that feedback. And of course, in COVID times, I do an awful lot of these webinars. I think I did 4 last week, including a conference presentation. So I'm really missing the in-person gathering. So hopefully when 2022 rolls around, we'll be able to get together in person. As is customary, affiliations and disclosures. As Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. I also wear a few other hats. I have a faculty appointment at Pacific Coast University for Workplace Health Sciences, which is a university dedicated to workplace health issues. So everything from work disability prevention, occupational health and safety, and in fact, I'm working on the master's program right now. So it's open in another window. I also sit on the executive board of the National Wellness Institute and the Work Wellness Institute, so that keeps me quite busy. Now, Jaime, as you know, is from Avedon Health, and as I mentioned before, our special guest today, Dr. Bonnie Kaplan, is a semi-retired professor from the University of Calgary with a very particular interest in nutrition as it relates to brain health or mental health, as some of you may be familiar with. There's our contact information on the bottom of the screen, as well as our relevant website. So feel free to visit those and always reach out on LinkedIn. Everybody loves to use LinkedIn. I use it a fair bit and definitely encourage you all to do that as well. So in our last session, we had a foundational discussion about the relationship between diet and nutrition, and a topic of great importance for both employers and for health plans. And that is mental health. You know, you can't really talk about workplace health and productivity without touching on mental health these days, whether it's, you know, pandemic driven, although we did see rather significant increases in year-over-year cases tied into or tied back to mental health conditions or brain health conditions, either as a primary cause of work disability or perhaps an absence episode, or a comorbidity or polymorbidity in a broader discussion. And so, you know, we did dive into the research in that sense. So what we wanted to do with this session is to bring the person who actually wrote the book on the subject and have a conversation with her around the design of benefit plans and basically unpacking all the disparate elements and science to a different degree than what Dr. Pulaand and I were able to do earlier on. And so we've settled on a few key questions here. And as Daryl mentioned, please reach out and type questions into the to the chat function as well. Now, when we're discussing the topics of stress, anxiety, depression in the workplace, obviously from either an employer-sponsored workplace health and productivity program, or even from a health system or health plan approach, whereby you've got plan members who may be impacted by these things. Usually, from a prevention strategy, we have various pillars: physical activity, reduction of alcohol, reduction of tobacco use. Diet is always in there from a variety of different perspectives. But usually, the relationship between diet and brain health is not necessarily fully understood by a lot of folks out there. Hence why we figured this would be a good idea to have this discussion. So my first question for Dr. Kaplan is, what does the science suggest are the missing keys for improved mental health or brain health, both at the individual and at the population level?
Well, thanks very much, Dr. Amell, and thank you everyone for inviting me to join you today. I'm really looking forward to this. So I, of course, will be focusing on nutrition. You asked what are the missing keys. We'll get to some of the non-nutritional ones later maybe, but in the field of nutrition, what really is missing are the micronutrients. Those are key. And now what do I mean by that? Just a tiny bit of jargon, and I promise not to give you any others, but we know that macro means big, micro means little. Well, in the nutrition world, macronutrients are the large categories like carbs, fats, even protein. But we know that our populations, we individually in our populations, are getting plenty of carbs. We're getting plenty of fats, maybe not always the best fats, but we're getting a lot of fats. We're getting even probably enough protein in North America. The micronutrients are what we're very worried about, and I'll show you why. But micronutrients especially refers to minerals and vitamins. Also maybe the essential fatty acids, some phytonutrients, etc. But what we know most about are the minerals and vitamins, and we know that they are essential every minute of every day. Every bite that we put in our mouths, even for breakfast, are very important for providing those minerals and vitamins to brain metabolism. We know they're essential there. We know that they're required for energy production. They're absolutely required every minute of every day to produce ATP, our energy molecule. They're needed to fight, and that's what we use internally to fight excessive inflammation and to make us resilient to stress. And we also know that the absence of adequate levels of micronutrients affects mental health. So at this point, I'm just going to make a couple comments about why we might be missing them and how I'm so confident that that's an important thing. The one we can call, the illustration really that I can call on immediately relates to better food choices. Now, you've probably heard the term ultra-processed food. I don't like to use that UPF acronym because a lot of the ultra-processed products that we buy in packages really are not food. If food is what we need to build cells and maintain cells, there's really not very much food in there. So these ultra-processed products are now the dominant food of the children in North America. 3 weeks ago, the US data came out from the National Health and Nutrition Examination Survey showing that 67% of what our children aged 2 to 19 are putting into their mouths are UPFs. In other words, essentially zero micronutrients 2/3 of the time, 2/3 of their input. This is a huge experiment and kind of a scary experiment that we're doing on our children. And by the way, we know the results from data from the 1950s that shows that cutting micronutrients by 50% results in all the symptoms of depression, anxiety, and even ADHD. So these are key. I'm completely confident in saying that, even though the public is not really yet aware of it, which is why we wrote the book.
Excellent. Thank you very much, Dr. Kaplan. So, a logical follow-up question to this, especially from a workplace health and productivity, and thank you for bringing up, the adolescent studies and the children's studies, because those are future workers, right? And as they move into the workplace, obviously they're going to carry on their history, the formative years with regards to dietary habits, food availability and all those sort of things. So it's a good way to make that segue. Now, for existing employers or health plans or sponsors, they're obviously looking at leveraging, the information that people like you produce with regards to how can we increase the level of micronutrients out there to help people out, and perhaps even drive down the pharmaceutical spend, because we know that pharmaceutical spend is significant on behalf of health plans as well as employers, a sizable portion of their benefit plan and benefit strategy. And of course, if there is a lower cost solution that is quite efficacious, then, as an employer, I would want to be interested in learning about that and how that can be used to drive the conversation and improve the outcomes. So our next question is from a brain health and resilience perspective. Now, what does an optimal wellness program within a great benefit plan really look like from your perspective?
Well, this is the most exciting question of the session, because I am so thrilled to be talking to people who can influence workplace wellness. I gave about a dozen talks to various companies 3 years ago before the pandemic hit. And I found them really receptive when I talked about things like creating a good food environment. We've all been we're not in the office very much anymore. And I don't mean just because of retirement, but because of the pandemic. But that reaction everybody has when someone walks by with a tray of donuts or muffins or something for the next meeting that's about to happen. And we all go, ooh, we can change that.
Do people react in the same way to fruit? What if a tray of fruit flies by?
We can create that, Tyler, because we did it with smoking. It became unacceptable to smoke in the workplace, right? And so we can do the same thing with the food environment. We can have beautiful trays of colorful fruit. We can have beautiful trays of colorful vegetables and delicious dips and hummus, etc. Yes, we can do that. Okay. So that's one thing that could be done in the workplace. A few more are, why not have education about the role of nutrients in brain function so that people know that burnout doesn't have to happen, depression doesn't have to happen. We can be more resilient. What about encouraging staff to share inexpensive ideas and recipes for cooking with whole foods and for healthy snacks? That can be done in the workplace. And then in the benefits program, I just was recently talking to a friend in Texas who's a psychiatrist, and she said her patients who are choosing to take nutrient supplementation, partly to decrease their need for medication, because that's what happens when your brain is better nourished. You can, even if you continue taking psychiatric meds, you almost always can decrease the dose. And so she said she'd never, and this is Texas, she'd never had a rejection yet from a health savings account to reimburse for those nutrients. And I don't know how characteristic that is across the US or any other country, but why isn't it possible? We've published data showing that people who move to micronutrients instead of conventional psychiatric care, that they saved 97% of their healthcare budget. So we know that it can be done. Who's going to step forward and take the leadership is the question, I think. So I asked to talk about a couple of other things, and I'm going to ask Tyler to show the next slide. This might seem like an odd thing to show everyone, but I find that people need to be convinced about the importance of nutrition for health. This is a classic study in science, the Dolinois study, showing two genetically identical mice, genetically identical, okay? The only difference is that the mother of the one on the right was fed a healthy diet and the one on the left was not. And the way in which they manipulated health had to do with methylation, et cetera, which is not of interest here, but it is a classic demonstration of what we call epigenetics and how nutrition alters our physical health. And the next slide, Tyler, shows the importance of this in human brain metabolism. And just briefly, if you will look at the red letters, you'll see that this is a tiny bit of the tryptophan pathway, showing the production of serotonin and the breakdown products. And every single metabolic step shows the micronutrients which are required for that step to occur. In other words, to get from tryptophan broken down in the bottom, can you move your arrow by any chance? Down to acetyl coenzyme A, which you don't need to know that name, but you need to have 1, 2, 3, 4, 5, 6, 7 micronutrients there. They're the cofactors that enable that step to happen. So this is how we all need micronutrients every minute of every day, perfusing our brain through our circulatory system. I'll pause there.
Excellent. Thank you, Dr. Kaplan. Obviously, this is a complicated diagram, especially for the non-scientists out there. So if you had to summarize the tryptophan metabolism pathway in a couple of different words, what would you use to describe this, to say, hey, listen, this is why this is quite important for the viewers today?
Thanks for letting me do that, because I don't think I summarized it well. Micronutrients are cofactors. Our metabolism everywhere in our brain and our body depends upon enzymatic reactions. You've all heard of enzymes. Enzymes don't work they don't work optimally without lots of cofactors present. So every minute of every day, you need to be pushing the cofactors, which are your roughly 30 vitamins and minerals, through your bloodstream and feeding those metabolic processes. Does that help?
Yes, thank you very much. Now, for the viewers, everything written in green here are items that you can actually see in a list of ingredients in the foods that you choose to eat. So by focusing in on these and making sure that you're ticking off the boxes when it comes to micronutrients, and as Dr. Kaplan pointed out before, eating real foods, not the ultra processed foods or whatever the best terminology is to refer to those sort of things, which won't have any of these in place, you can see how you can make direct lineage between what is happening with the food that you intake. And remember, food is medicine, as Dr. Pulaand and I discussed last time. Now, I'll just add one color comment. I remember a few years ago, I was invited to speak to a well-being vendor. This was a combination of health technology and behavior change platform. And I walked into their boardroom and I sat down. I was meeting with their CEO and their entire senior management. And to my surprise, they actually had fruit, kiwi, blueberries, raspberries, strawberries on the table, which were color coordinated with the logo of the organization. And I was blown away, and I'm a big fruit eater. So I actually sat down and I ate fruit the whole time I was presenting, and it was wonderful. I have never had that experience with any other firm. And I always bring that up because it was quite enlightening to see, the connection there. Now, one of the things that you and I have chatted about before, Dr. Kaplan, is the cost. Now, we talked about the potential to decrease pharmaceutical spend with regards to, dialing back on medications, either anxiolytic or antidepressant medications, and some of the work that you've done in that sense. But a logical question for follow-up is, we've heard that people say, well, can I really eat whole foods? Can I really eat better? Because it looks like it's a heck of a lot more expensive to consume those foods and purchase those foods than it is to get that ready access, easy to throw into the shopping cart approach. So what are your thoughts there?
I love being able to dispel that myth. We have scientific data, we have clinical anecdotes, we have personal experiences all saying, hey, as long as I don't have to eat lobster and steak twice a week, I'm saving money. Because whole foods, especially if you learn how to cook, especially with things like lentils, dried beans, legumes, etc., will save you so much money. The people who are buying food from convenience stores and vending machines, that's expensive. And I don't mean just the expense of the ultimate ill health, but it really takes a big chunk out of your pocketbook. A healthy whole foods diet can be done less expensively. And this is something that your wellness programs could experiment with. You could have people track, figure out for a few weeks, everybody writing down what they're spending for their family food budget, and then learn something about whole foods cooking, etc. And they will see that virtually everyone will save money.
Excellent. Thank you for that. Dr. Pula.
Such a fascinating conversation, and even the high level biochem 101. And I love how we are just making it so applicable that it's all about role modeling. And Dr. Kaplan, it was so relevant that you shared that study with the adolescents and the children, because regardless of, we're talking about the culture in the workplace, we all come home to families, or at least we play a very important role in that. So as a registered dietitian and an exercise physiologist, I get asked this question a lot. And so I'm quite interested to learn your perspective. What are the actual components that our minds and our bodies need for optimal health?
Well, thanks for splitting that in two, because it really is two questions, Dr. Pula, but I'll answer both. What do we really need? We need love. We need fulfilling jobs. We need to feel safe and secure. We need social support. We need exercise. But in the area of nutrition, as you know, we need everything. And so we have to drop this magic bullet way of thinking, of saying, well, which is this single nutrient which is going to make my brain work? I just showed you that metabolic slide for a reason, to show you how just in that tiny, tiny corner of serotonin and tryptophan, you need at least a dozen. There are roughly 15 vitamins, 15 minerals, a whole bunch of amino acids, the essential fatty acids, and all the phytonutrients. You have to get these as best you can from your food.
Yeah,
So-
and I just really appreciate how you brought to light those social determinants of health, that social support, when we're talking about loneliness and social isolation right now, especially during the pandemic. Could you give us a high-level overview of the science that supports our mind-body nutrient needs? I know it's hard to do in a minute.
That's why we wrote the book. We cover correlational data, longitudinal prospective data, treatment data with both whole of diet and treatment data with supplementation. So we present the whole gamut. It's all written for the general public. So what I'll do for you is pull out one sample. We just had recently, I think in Canada anyway, National Suicide Awareness Day. Never heard mention of nutrition, not once. Why not? In the British Journal of Psychiatry, very recently, a study from a very excellent team in Japan showed the data on 90,000 adults that they tracked for over 10 years, looking at all of their health habits, including dietary pattern. Suicide was the cause of death only half as often in those who were eating a whole foods diet compared to other diets. That's a prospective longitudinal study, and it proved the important protective effect of dietary intake. Why won't the media cover this in North America? I don't know. I can guess why, but none of our nutrition research is being covered in that way, that our diet protects our brain.
Excellent. We just honored Suicide Prevention Month last month, and I'm so glad that you brought that up.
Mhm.
So, we've been talking a lot about this, about communicable diseases like the virus that we're all facing right now that we can't catch, and those communicable diseases that, we can catch the virus, but we can't catch, say, breast cancer, right? What is the power from wholesome foods grown in nutrient-rich soil?
Well, it's very fundamental. We really are what we eat. I mean, I don't know what people think their cells are made of, if not the nutrients that we consume. So we have to pay, we don't have time to get into it here, but there's a huge issue for agriculture, and we have half a chapter on that. We all have to be more aware of the problems, the challenges in the soil, because plants that are grown in mineral-rich soil absorb about 15 minerals. And then they use those minerals to do something that you and I cannot do. They manufacture approximately 15 vitamins. And then we come along and we eat the plants, which hopefully have all 30 of them then, or we eat the animals that eat the plants. And that's how we get the vast majority of our minerals and vitamins.
So you mentioned 30. Can we get enough of the power that we need in food alone?
Well, most people, or I'd like to cancel that word most. Many people can, But we have very good reason based on the scientific literature to believe that some people cannot, and that there are individual differences. So Dr. Pulaand, maybe you need more maybe you've inherited the need for more magnesium than I have. Maybe I've inherited the need for more vitamin B6 than you have. And these individual differences in brain health are not yet worked out.
Absolutely, not one size fits all. So we've just begun to touch the surface of what you and your colleagues have been working on. And, you know, we're talking about the onset of disaster, both man-made and natural-made. We reviewed this last time that Dr. Amell didn't have you present. We're so excited that you're here. And, you know, if one of the things I've been really wanting to ask you, if you could share in your own words, what does resilience mean to you?
I don't have time to go into the triage theory here, but the basic element of it is that if you have no stress in your life and it's a calm period, etc., you probably can get enough nutrients from your food. But when you are in fight or flight or a pandemic or exam stress or, you know, whatever, that you probably need more of those nutrients to provide the resilience that you need, because your body is doing this triage of making sure that the alarm and the fight and flight stuff is covered. And you need to make sure that all the basic processes are covered too for a healthy brain and body. So resilience to me means having a really solid amount. It means eating well.
So there's a prevention factor, right? It's a built-in, so if trauma or stress kind of catches up with you. So I know you shared some wonderful tips with us, but what do you suggest we do to improve resilience to trauma and stress for the people we serve?
I think it's all a matter of education. I mean, if the concept of cofactors were taught, as I've taught it down to the 6th grade, we're taught to children, it's taught in workplaces, if it were taught in medical schools, I mean, right now it really is not, then we would all understand how important it is to feed our brains. Every bite that we put in our mouth is a choice to feed, and our brain is the greediest organ in our body. It's sucking up way above its weight the proportion of nutrients and oxygen, etc. I mean, we're just focusing on nutrition, but we really have to focus on our brain health more than anything for resilience.
Excellent. Thank you very much. Great discussion. So Dr. Kaplan's book, along with her co-author, is The Better Brain. We're coming up on time here. We do have a couple of quick questions. One is, what does the research show about timing for meals? You know, should we be eating 3 meals a day, or can we separate that out into, 7 meals a day or even 10 meals a day? What are your thoughts on that quickly?
Quickly, I want to just say that anybody with a question that we don't have time to answer, go to my my website and you can contact me there, and I always answer emails. For this particular question, I'm going to punt and say I think it's individual differences. I don't think there's any scientific literature that says everybody has to eat the same way, but it's what you're putting in your mouth that matters the most.
Excellent, thank you. Now, another question that Dr. Pulaand and I had in our preparation discussions here for this session is, if you could eliminate one food or one source of foods from workplaces, for example, or even hospitals, a great example, because some of us spend a lot of time there, and kind of shake my head at the nutritional options there. What would that be?
Well, some of the strongest longitudinal data shows that our intake of processed carbs has really replaced a lot of our micronutrient rich foods. So our examples of muffins and donuts as snacks, replacing them with fruits and vegetables, that would be brilliant.
Excellent. Thank you very much. Well, once again, we really appreciate the opportunity to join us here today, both from MediKeeper's perspective and Avidon's perspective. Very much enjoyed the conversation. As Dr. Kaplan has pointed out, if you want to reach out to her directly, feel free to do so. We did provide the contact information earlier on. As well, you can always reach out to Daryl Gordon, who is the Vice President of Marketing at MediKeeper, for additional technical questions or anything related to that. Over to you, Daryl.
Excellent. So clearly we could have spent much longer on this topic, And clearly tonight, the book I need to be reading at bed is The Better Brain, based on my diet. But I wanted to thank our doctors on the call. The content was fantastic. We appreciate your time and sharing everything with us. A copy of the session will be available on our website in a couple of days, as are all of our prior sessions from early in the year. Thank you for joining us. I hope everyone has a great day. Be safe, be careful.
Thank you very much, everyone.
Yes.